get you, you can unplug it. And get you covered up here. Beautiful. All right, so first I'm gonna check for something called JVD, okay? So I'm just gonna have you look that way. Beautiful. And I'm gonna palpate your carotids just one at a time, okay? All right. Beautiful. I'm also gonna listen to your carotids, okay? And that's gonna be with the bell of my stethoscope. And hold your breath for me. Beautiful. And the other one, hold your breath. All right, great. There are no bruises that I hear, and that's good. So next we are going to listen to your heart sounds, okay? So we're gonna start at your aortic, and we're gonna listen on both sides, so it'll be a couple tries, okay? All right, so we're gonna start your second intercostal space, your aortic, and we'll move over to the second space, and this is your pulmonic. All right, and then this one's a little funny. This is like your third intercostal space. This is your herb, so it's gonna be a little bit in here. Beautiful. Flip it around. All right, and then we have your tricuspid. It's gonna be beautiful. Oh. And finally, I'm gonna listen to your mitral for a minute, okay? All right, beautiful. I got about 64 for your heart rate, which is about what we got last time. So next I am going to move down to your abdominal area. Okay, so I'm gonna pull this down, have you pull your shorts down a little bit. So first of all, I'm just gonna take a look, okay? I'm gonna note it doesn't look like you have any like bulging or abnormalities. I can say your pulse, that's good. All right, so I'm first gonna start by listening, okay? So I'm just gonna listen to your bowel sounds. Awesome, and then while I'm here, I'm gonna listen to your abdominal arteries, okay? So, all right, so here we have the aortic, the renal, the iliac, and finally the femoral. Awesome. All right, so now I am going to percuss your abdomen, okay? Pull these down a little bit. Awesome. All right. And we're gonna find that dull area. That's gonna be your liver. Beautiful. Stomach is hollow. That's good. Beautiful. Now I'm going to palpate. Okay, just let me know if this hurts. Okay, I'm gonna do some light palpation. Any pain?
Nope.
All right, and then some deep palpation. No pain there?
No.
All right, awesome. I'm gonna move down to your legs, okay? We're gonna cover you up. All right.
I'm sorry, I didn't start you.
All right, so I'm gonna start with your capillary refills on your toes. Sure, good. Feet are a little chilly, that's normal.
Yeah.
All right, great. I'm gonna check your pulses and have you bend your knees a little bit to your popliteal. All right, and then you have your posterior tibial pulse, and then you have your dorsalis pedis, which is on top of your foot. All right, great. And then I'm gonna check for edema, which is not present, which is good. It means that you are hydrated. Next, I'm going to do dull and hold on, let me look at my paper. Oh, I'm gonna do dull and sharp. Okay, so what I'm gonna have you do is I'm gonna have you close your eyes. This is going to be dull, and this is going to be sharp. Okay? Can you tell the difference?
Yeah.
Perfect. I want you to tell me where it is on your leg and what it is. Okay?
Okay.
All right. Here we go.
Sharp right shin. Dull bottom right foot. Dull bottom left foot. Sharp left above the knee. Dull right thigh. Dull top right foot. Dull top left foot. Sharp left shin.
All right. Perfect. All right. So you got 7 out of 8, which means that your function's good. Okay. I'm gonna have you now. I'm gonna have you. You can put your shirt back on. I'm gonna have you sit back up for me. All right, perfect. And I'm gonna have you just kind of sit on the edge of the bed real quick for me. Are you feeling dizzy at all?
No.
All right, I'm gonna check your reflexes. It's hard when you think about it, isn't it? Okay. And then I'm gonna have you put your shoes on for me. Do you need help? You can bend down. You don't feel dizzy.
I can do it.
Thank you.
Oh.
All right. So when you stand up, I'm gonna have you stand up slowly. We're just gonna wait there for a second, okay?
Okay.
All right. Ready? Beautiful. You don't feel dizzy, nothing like that? All right, perfect. I'm gonna have you stand with your feet shoulder width apart. Close your eyes for me. We're gonna do a Romberg test real quick. Awesome. So you have a negative Romberg, which is good. So now I'm gonna have you walk normally just to that chair, okay? All right, perfect. And then heel the toe back for me. Awesome, great job. And I'll have you sit back down on the bed. And finally, I'm gonna give you a Braden score. A Braden scale just tests like how at risk you are for pressure ulcers. And you have a good diet. It seems like you get enough exercise. Do you have any issues like dressing or going to the bathroom, anything like that?
No.
Great, so I give you a score of 23 on the Braden scale, which is good. It means that you have a low risk of pressure ulcers. And yeah, looks like we did it. Great job.